Dr. Todd Singleton, and I'm here to explain to you how spinal decompression therapy works. Years ago, when you were in your teens and 20s, you probably had some kind of an accident, maybe a car accident, maybe a sports injury. What happens is you've got 24 of these bones in your spine, and in between each bone, there's a little bit of it's called a vertebra. It kind of acts like a little shock absorber. It helps with the motion and movement of the vertebra. In the back of the vertebra are these little guides. They're called facet joints. It helps you bend and extend and stop rotation to a certain point. Now let's say you go through life and you're feeling pretty good. You're having some stiffness in your 20s and your 30s. And around in your 40s maybe you start to, or late 30s and 40s, you start to have some pain. Here's what happens. This nucleus, this part of the disc, is contained within these fibers. These fibers surround this disc. Now, if these fibers start to become weak and start to fray, as you can kind of see this right here, these fibers allow the disc material, when they're torn, to start to push this nucleus out to the side. Now, if this continues to be pushed with additional pressure, maybe you're sitting a lot or you're bending a lot, it pushes this disc bulge right out, right onto the nerve root. When this happens, you can have immediate back pain, or maybe you've had some chronic stiffness, muscle spasms in your back for a long time, and then down the road you start to have the leg pain, the old sciatica, the poker, the hot, the burning goes down to the knee, goes down to the foot. You may have this, or you may just have some low back pain. This can be treated with spinal decompression therapy. Because of the compression forces here on the spine, the decompression program allows the body to decompress. So we have a table, we have several tables that you lie down either on your stomach or on your back, and we strap a special strap on you. And what this does is it lets us pull the body very slow, very subtle. It does not hurt at all, and we're decompressing the spine. So we're pulling, and as we pull, we are creating a negative pressure on the inside of the disc. Now this negative pressure allows the disc to approximate. And with time, each visit to visit allows the nutrients, the fluids, the blood flow back inside, raising the height of this disc space. There have been studies that have been shown, pre and post x-ray, that the disc height has actually increased. And as the disc height increases, the pain decreases. So don't wait until it gets down to this state where it's literally bone on bone. But if you go to my website, you'll be able to actually see that I've had several patients that have what's called stenosis. We've actually been able to help a lot of these patients with spinal stenosis. So I'm Dr. Todd Singleton. I've been doing this for 20 years. The first 2 treatments are no charge or complimentary, so call me at 801-265-3400 to see if spinal decompression therapy is for you.